Excellency Madam Huria Al-Mahdi, State Minister for Women and Social Affairs, domain experts from India who have come to Addis Ababa for this specific event, Indian investors from Administration and Ministry of Health, experts from African Union, African Center for Disease Control, healthcare professionals from India and Ethiopia, and members of Indian community, Friends of India. This is the health burden of Africa. How Africa health situation is, the data is captured up to 2021, means it was captured till 2024, and this is how it has been projected. So you will see that overall, like any developing country, the situation where India was in 20 years back or 30 years back, where the non-communicable diseases were having a prevalence, and through very special nationalized program we managed to control it. The same is the situation where Ethiopia is.
As the Ministry of Women and Social Affairs, we believe that the health and empowerment of women are critical to sustainable progress. Through close collaboration with Ministry of Health, Ministry of Agriculture, Ministry of Education, we ensure that our policies are inclusive, gender responsive, and focused on the most vulnerable groups. For years, India has been a preferred destination of Ethiopians seeking advanced medical service. From cardiac and cancer care to neurology and fertility treatments. I can be a witness. My sister is just had a cancer, but she cured now, totally here. She went to India, and her daughter has an access to get a job opportunity, which is the hospital treatment. So I can be a witness personally. So I would like to thank India for this.
For many years, we have been forgetting the Indian traditional medicine value, and again there is a resurgence thanks to our Prime Minister Modi. Next slide, please. Yeah, this is about Ethiopia and India partnership healing together. We are ready to collaborate with the doctors here in terms of training and also visiting and training them, and also by providing some of the equipments. Next. So this is my topic, my forte. I am a hardcore interventional cardiologist of 3 decades of experience, trained in United States. But currently we are training many people in our country itself because of the progress that has happened. So when you look at the interventional cardiology, that means without opening the chest, we do those procedures through the arteries that are available either in the arms or in the legs. So I conclude with a shloka, Sarvepi Sukhina Santu, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kashit Dukkha Bhag Bhavet. Meaning, let everyone be happy, let everyone be free of disease, let everyone see good, and let no one suffer misery. Thank you very much for your attention.
Okay, thank you. Your Excellency, Mr. Ambassador, I would like to congratulate also the teams of the embassy for arranging this opportunity and also briefing session. So I'm Awad Selassie, and I'm a journalist in African News Channel. I'm raising a question that is the embassy taking a place of or an opportunity of arranging visas and special offering special arrangements for these medical travelers and also their caregivers who are going to take that kind of medical travel to India. Thank you.
Yeah, so we follow the most efficient visa system. You come with complex papers. I have 5 people who sit from 9 in the morning till the last patient comes, and we first dispose of all the doubts, then only we accept the fees, and in emergency cases we give in 3 hours, in routine cases we give in roughly 15-16 hours. And on Friday, I know that most people come from far-flung area, including from Somalia. So we give on the same day. So that, and we have also announced it. so that no one have to stay back to Addis for a mere thing which is visa. If a person goes for follow up and we see that, we are very seeing it from humanitarian angle that a document should not be a burden on the person, the patient, the relative to travel to India. So we start giving them long-term visa. So this is what we are doing. Last time when we take the journalists to India, your fraternity, so we also take them to the Indian medical facilities to showcase that what competencies we are having, so that you try to replicate in your system and publish your own stories.
पर सोच लूं इस पर जो पर जो है सब
Ethiopia and Kenya are the two largest economies in this part of the world that actually have patients seeking treatment abroad. But what are the key things that we can look at in terms of offering high quality healthcare at affordable prices? Now, when we say affordable prices, we are referring to patients coming from all sources of funding. Broadly, when we talk of patients with different sources of funding, you know that certain countries, the Ministry of Health funds treatment of patients. They come with a guarantee of payment letter funded by the Ministry of Health. Examples are Oman, Iraq, Mauritius. Some of these countries have good funding for patients. Second source of funding is private insurance, which one of our colleagues brought in the morning session, where there is a great opportunity to partner with leading insuring firms that provide funding assistance to patients. And third is cash patients. And in cash patients, what is it that we can do to subsidize treatments and to basically have a good, you can say, quality of treatment being offered. I just want to summarize where India stands out in terms of some of the most advanced technologies available in the world today. And India is offering these treatments at a fraction of the cost compared to any other country in the world.
We have this three pillars that have been working very well for us, and not only for Fortis Healthcare but for all the Indian healthcare industry. And the three T's are the talent, the technique, and the technology, which we have really been focusing on. So my presentation will be highlighting on talent, technique, and technology, also our centers of excellence, and then I'll lastly be talking about the opportunities which lie for India and Ethiopia collaboration for the healthcare sector.
On how we can collaborate and what kind of surgeries we have started doing recently, and what kind of success rates we have been actually, how successfully we have been doing these surgeries at our hospitals in India. Shall we start? The first, next one please. So I'll start with the company overview. Max Healthcare is one of the largest healthcare providers in India with 22 hospitals across India. We are a quaternary care hospital. We do most of the high-end work.
Why India is becoming a transplant hub? We all know the global problem with the various comorbidities like non-communicable conditions increasing diabetes, increasing hypertension. So we see a lot of patients coming with complications because of survival of these patients is increasing. So especially the renal issue, the kidney issue, the global prevalence of kidney issue is increasing. We have present CKD prevalence of 10%. So in that, if you don't prevent, the progress to end stage kidney disease and land up in dialysis.
Good afternoon, everyone.
My name is Gurmacho Mamo. I'm a medical doctor and public health specialist with over 30 years experience in the public health sector in Ethiopia. And today I'm here to provide my testimony for a medical center in India called Asian Institute of Medical Sciences, which is in short is Asian Hospital, where I underwent a medical treatment for heart problem. So the story starts in November 2023. I had a major health incident in my life. I had a heart attack. So taking my background, I made the diagnosis myself. I know that it is a heart attack. So I went to the hospital, to Washington Medical Center. Then the diagnosis was confirmed. Then immediately I went to Asian Hospital. So it is very important to have your confidence and trust, when you travel. I've been traveling to many countries and I have no problem with the traveling experience. But, when it comes to health, when it comes to this kind of issues, you need some actions. So I made my decision. I went to Asian Hospital. The welcome was very exciting. They were waiting me at the airport with flowers. It was, even though it was midnight. So they accompanied me to the hospital. The next day, I went to the investigation, and the other day, I was on the hospital bed for the PTCA. So it was affordable because I have been receiving a lot of offers.
My name is Zakaria Mohammed. I went to Max Hospital at Saket in New Delhi. My experience there was exceptional, and the team, the staff was highly skilled, highly skilled, talented, providing efficient, effective and compassionate care for me. The hospital environment was patient friendly, and they were giving me a great hospitality which felt like home. And in communication wise, I had no problems compared to my experience in Europe, where we had to have a translator to communicate our problems for the doctor. And most of all, I'm really grateful for Max Hospital for giving me this treatment. I underwent a neurological treatment there with Dr. Mukesh, and I received a world-class treatment where I feel like everybody was treating me like I was here in Ethiopia. And I recommend for your next advanced treatment, Max Hospital, of course. And I'm planning to go soon for treatment and checkup as well. Thank you very much.
Cultural and linguistic barriers. I mean, you might have also faced that. So, in that situation, how do you interact and how do you make the case history of the patient before deciding the advanced medical procedure that needs to be done?
Thank you, His Excellency Mr. Anil Kumar, for inviting us, the distinguished Ethiopian guests and my dear colleagues. It's a privilege to be here and speaking about India healthcare. Like multiple speakers have already spoken about from the morning, we have a very favored travel destination for mainly two reasons. It's not only marketing, right? Here, everybody who spoke about it as a patient, as a person who is generating so much revenue to the country and all that. In addition to all that, I don't deny that is a very important point. In addition to all this, the most important thing is an empathetic care. I think that's what Indian clinicians are. Like Mr. Anil already spoke about, we are a very culturally diverse country. So coming to the question that how do you manage this cultural and linguistic, it's an inborn talent. Like Mr. Anil very clearly said, we have so much diversity in the different states of India that when these patients come to us, we are very happy to integrate with their culture, understand their culture, respect for their culture. So there is absolutely no discrimination when they come to a country like India. We don't treat them differently at all. So we integrate them into our system. Everybody, from the person who receives them in the airport to the clinician or to the doc admin in the hospital, everybody is culturally aware so that the patient gets a wholesome experience and he feels happy with the experience. He never feels that, oh, I'm being discriminated, they're looking at me like some kind of a revenue generator. So that does not happen. I think that is the most important thing that we need to understand and reassure all the people who are here so that they get the confidence to send them to our country for this medical travel. Coming to critically ill patients that you were talking, I think we already discussed that again in the morning. The most important thing, obviously, is to have a clear, detailed picture before you reach us. So, like all of them said, we all have offices in Addis Ababa or other different cities in Ethiopia, and we are lucky to have a doctor who heads our center in Ethiopia. So that way, what happens when there's a doctor who is heading, is able to communicate with the patient, elicit the history that you were saying in much more detail, so that we have a clear picture when we come to India. So the doctor here clearly understands that we have doctors in multiple cities. So it's not just some non-doctor or a common person who is advising them. We already discussed that, right? So we don't have a common person. We have a dedicated medical doctor who is trained in Ethiopia. So he knows and understands the local sensibilities and sensitivities of each patient. And we get a very detailed history. And we already discussed about video consultation. So the doctor facilitates the video consultation. So that way what happens, we get a very clear picture before the patient actually arrives in India. In spite of all this, if the patient still has a challenge, we are very open to do a video consult. We physically see the patient in the video consult. We give them the list of precautions that they have to take care, because especially critically ill patients, like you said, may have an issue during travel. So we make sure that all that queries and concerns are taken care of so that the entire process is very smooth and comfortable for the patient.
Like what Mr. Raghuram said was one of the noted epidemiologists in Ethiopia with an international exposure as well. Could you please tell us something about the health burden of Ethiopia due to the tropical and neglected diseases and why international cooperation in this particular space is needed, and what do you expect from India?
Thank you very much. First of all, I'm coming in a capacity not as a country strategic advisor, but as someone who has lived and experienced in India for 8 years. So currently, as one of the Indians, we have traveled from north to south, as far as Shillong and as the top end of Kenya, Kumari, and all the way, maybe I have traveled more than any Indian in India.
Quite possible. I have not seen Shillong till now.
That was unfortunately because I was working in the WHO regional office in South Asia at Indra Prasa, living in Anandikitan. So I have had the privilege of meeting all the institutions which are represented here. And number one, as a professional working with the WHO, and number two, as a client, because the WHO staff are also managed and treated at these hospitals. I was in Max Health. I know Max Health for some time. I was in Apollo, visiting, in fact, one of the renowned human activists, Professor Rosari is there from Ethiopia, but also with other people. And also I was in other medical colleges like AIMS, or India Institute of Medical Science, ICMR, and a number of them. Coming to the very specific question about the burden of tropical diseases, we know that India and also Africa share much of a common denominator in terms of emerging infectious disease. Much of it happens to be tropical disease as well. For one, one of the things that we see is during pandemics and epidemics, many of the emerging diseases happen to come from infectious disease origin, which some of them are tropical, but others may not be. And the technology and skills that India has been attested several times. Number one, during the avian influenza outbreak, that was not yet even a pandemic, we had to rely on much of the diagnosis capacity in developing countries, because testing, as those days coming from the developed world, quote unquote, took quite a long time. So it's very important that India generates and also produces. It has one of the most known biomedical centers. It has one of the research institutions which has the capacity and can lend hands to African countries as well, Ethiopia being one. And at the same time, the factor of tropical disease and the connection between tropical disease and pandemics usually is very much related. About 70% in the rough estimates of the diseases that happen to affect populations happen to be tropical disease in Ethiopia, ranging from those that can emerge as epidemics to pandemics, but also those who are not necessarily manifesting as pandemics as well. One of the things also that was not discussed in this session is also major disasters. India has a very well experience in disaster management. I was in Orissa during the floods, during the tsunami 2005, And India was able to mobilize medical teams very rapidly, and this is also applies to Ethiopia as well. So looking beyond an urban tropical disease, we have to look also into mass casualties, which happens to have, some of the spinal surgeries that we talk about, the road accidents, traffic accidents. So let's look into beyond an urban tropical disease and look into what can India provide in terms of learning platforms. I know many of our faculty staff were also Indians, but it's very important that we go beyond patient referrals to institutional linkage, meaning twinning of institutions. I tried for myself when I was in India, trying to bring people to some of the hospitals like Hyatt Hospital, Landmark, and a number of others. And in fact, we organized also a visit to Fortis with the former Minister of Health, Dr. Teodros Adhanom, who is now the DG of WHO, and we were well received by your international cooperation team. We thank you for that. And much of the lessons that we do is until we have institutional linkage, it will be only on self-referral patients only. So it's very important. There were issues related from the universities that was raised, and those universities, they have to find out a way to link into institutional linkage. One is exchange of faculty, but the other one is also virtual faculty, as was discussed earlier. So it's very important that, yes, tropical diseases are very important, but there are major problems also which apply to the non-communicable disease as well. We were trying to explore possibilities of bridging these types of gaps, because Ethiopia being the hub for Africa and having a direct connectivity to India, you can have also a very easy access for infectious disease transmission as well. So you look into both sides. You minimize risk to the other parts of the world, but also you import and you bring expertise and talent as well. India is a global hub, we know it. You go to the States, you go to the UK, the best nurses happen to be from Kerala, for that matter, in that sense. And I think there's a lot that we can share and do at the same time. Thank you very much.
Thank you.